Today on Community Watch, we have a conversation about the Health Initiative for Men and Women, which is an event that the 100 Black Men of Rome, Northwest Georgia, have been sponsoring and putting together for many years now. It's a very important event. You want to know about it. Community Watch starts now. Welcome to Community Watch. I am very excited to have with me today Erin Hernandez, who is the President and CEO of the Northwest Georgia Regional Cancer Coalition.
Yes.
Did I get that right?
That's correct.
That's amazing, really. But we are here to talk about the Health Initiative for Men and Women, which has been being put on by the 100 Black Men of Rome, Northwest Georgia, in partnership with many others.
Right.
And you've been involved with it for how many years?
Since 2012. So, been doing it for
12
quite a long
years.
time.
That's 12 years.
Originally
the
started.
Quick math.
Yeah. This is the 24th year, it's the 22nd event. We had a couple years during COVID.
Right.
That we took off. So it was originally started with Harbin Clinic, and they did it for a long, long time, and the Department of Urology, and then we picked it up in 2012 and began hosting it, helping the 100 put it together and get it together, all the clinical services, and we added the women in 2016 because we had two different events. We had the men's health fair and we had the women's health fair. So here we are.
And if I remember correctly, and this may still be the case, in order to get the men there,
right,
it really required the women.
Right. And it does. And there was a lot of times at the men's event, the wives were with the men. And, you know, having the women's event coming and having all the partners that were bringing services, you know, we wanted it to be to where we weren't having to tell women, oh, wait your turn, yours is coming next. And so, and it was a real, you know, drain on community resources to have to dedicate 2 Saturdays and, you know, try to budget their time and effort and money and funding for those events. And so putting it together just really worked out well.
And men are, well, it's just actually my question. Are men still just as reluctant to have their health checked as they were when this started? Or
your next guest sitting across the room tells me yes.
Yes,
I think it has
fine.
improved a little bit over time. I think that men do take a little bit more responsibility. I think the community messaging, not just here, but you know, across our country, and with the advent of social media and other things, those messages are shared a little bit more broadly. And so I think people do know in the back of their mind that men do know that it is important to take care of their health. And I think they know they need to, you know, be around, take care of their families. So I think probably there's at least a greater awareness, whether they follow through or not. But I would say that we do, through our organization, we do pretty much just as many screenings for men as we do for women.
All right, before I get too far into the health initiative itself, tell me exactly what the Cancer Coalition is.
Sure. So we are a collaboration of about 18 counties across Northwest Georgia.
18?
18 counties. We started out at about 10. We've added a few more on. Kind of depends on screening partners we have in the area, and just we call it asset mapping, you know, what those assets are and those resources to do the work. There are 5 cancer coalitions in the state of Georgia. We're known as the Regional Cancer Coalitions of Georgia. We are state funded. We're legislatively appropriated funds through the tobacco settlement dollars. It flows through public health. And with those dollars, we do a lot of just prevention. We work and we try to provide awareness and screening around any cancer that can be prevented. So things like brain cancer, we can talk about it, we can tell you about it, we can help you through your journey. We're not out actively working to prevent it because it's not something there's not a screening for it. There's not really a prevention for it at this time. However, breast, cervical, colorectal cancer, lung cancer, prostate cancer, all of those things have a screening associated with it, and something that we can do to help encourage people to stay healthy, stay on top of their screenings, and detect it early. So your survival rate would be greater. We do a lot of tobacco education in schools, vaping education. We do a lot of education around the HPV vaccine. It is cancer prevention, so we talk a lot about that, particularly with like middle school age students. We want to get them before they become sexually active. And then we do a lot of screenings. That's where most of our money goes toward, is screenings for people who are either uninsured or underinsured in our area.
So I imagine that the Health Initiative event itself involves a lot of education.
A lot of education and a lot of screenings. And that is unique to this health fair, is the fact that screenings are offered. Many times you go to a health fair and you go from table to table, you get lots of great education, learn about a lot of great resources, really, really good events. But at this particular health fair, for 22 events, 24 years, actual screenings have been offered. So we're doing blood glucose, doing blood pressures, doing cholesterol. We give out even the FIT kits for colorectal cancer screening. We do PSAs. We do mammograms on site. We do women's clinical services, pap smears, all of that on site that day at the health department. Some skin cancer screenings. So just a really, really great event. For some people, it's the only health care they get all year. And we work with them to try to, pair them with a primary health care provider of some sort so they can continue to get that health care.
So, August 17th.
Correct.
Which is a Saturday.
It's a Saturday from 8 to noon. Registration, people start lining up usually around 6:30 or 7 to get in. They want to get into that PSA line because it can get long. And we go to noon. And typically we'll have another day of mammograms. The mammo bus from Atrium comes. They do 25 mammograms that day. You pre-register for those, and then if they have overflow, they'll do them another day that week. Or sometimes we have women who were identified during their clinical exams of needing a mammogram, so we're able to walk them over to that table and get them signed up that day as well.
All right. So on August 17th, people start lining up 6:30.
Sometimes.
That's crazy.
Yeah. And we've had as many as 450 people in years past. Since COVID, we've not had quite that many.
Right.
But it's getting back to that. It's getting back to that. So.
All right. So setting up an event like this with so many aspects, so many different pieces of it, you get you have to get doctor volunteers.
So we have quite a robust group of planners at the table. So Advent, Atrium, Harbin, the residency clinics, the internal medicine clinic over at Advent. I said Harbin. I mean, really just anybody that's doing anything in healthcare. And it is the one event I feel like in town that is just not territorial. Nobody comes to that event trying to outdo the other. Everybody has their role. They know they bring as many resources as they can. It is truly for the community. It is just quite amazing how many people are there. This year, we'll also be doing some food distribution. We'll be doing some cooking demonstrations. This is actually the first year, believe it or not, that we will have some type of like a thank you event for all of our organizers. Because they just come so selflessly and do it every year. And we always try to say thank you. We have students that come. So the students from Rome High School's College and Career Academy, their healthcare pathway, they come help us out, which is very valuable. And let me tell you, those students are dealing with some like real life adult things that happen that day. And they are learning of what, that is going to look like in the future for them. So, and then our dental students, our dental hygiene students from here at Georgia Highlands. We have students from GNTC that are in nursing. So I come from an AHEC background as well. So this kind of workforce development is really important to me. I know when I'm old that I want these students who have gone to school to have had these experiences can help treat me. So we like to do that. It is much about the people that are there working together, networking, getting to know one another as it is for the community. I mean, it's just a great day.
And it is free.
It is free. Everything is free.
So I know initially, and we'll be talking to Bonnie Askew in a few minutes about the 100 participation, the creation of it. But for many people, initially men only, but now men and women, it's a pretty comprehensive checkup of their health status.
It is, and if people truly go to every screening that's available. And again, lots of resources there, lots of connectivity. This year we have Morehouse. They're bringing their PA program as well, and they're going to help us out. They're going to help us out with some HIV testing, as well as some education around the PrEP drug regimen that people can take to prevent HIV. So they're going to be talking about that. The health department is the only place in our community that has access to that, and they're the distribution center, so they'll help us with that education. But HIV is on the rise again, and we find also that a lot of our HIV patients, they see their infectious disease control specialist pretty exclusively, so they're not always getting that message around screenings and cancer preventative screening. So for us from the cancer space, that's something that we're really interested in making sure they know about that. So that's new. It's a great deal. And I leave every year, I've got folks that I recognize them. I know them by name. I know them by face. They come every year and they'll come tell me their cholesterol numbers. Oh, it went down this year. I've been walking, or, I really started rinsing my beans instead of just eating them straight up. Things like that. And it just does the heart good, to hear their stories and see, their health journey, and knowing that everybody wants to be at their best and be their healthiest.
And you've been involved long enough to, people get they get some news.
They do. They absolutely do. We spend about 3 weeks after the event, responding to what those screenings were. Did they have a bad PAP? Was their PSA not quite where it needed to be? It is tough, and we make sure that they have ongoing care. What's the next step in their diagnostic journey, or is it straight to somebody else, a provider? And so we make sure that they have those resources available and are able to get the care that they need.
And there is a good chance, I imagine, in those cases, if there was not a health initiative, they would not know.
Right. And that's one of the big things around prostate cancer screening. For many years, it kind of got a D community rating. That's kind of what they call it for these community-based screenings. And it was a D grade. They did the kind of clinical guideline was that you not do community-based PSAs anymore. And the 100, to their credit, said, no, we really feel like this is something that we feel like the men in our community are kind of missing out on. We want to stay strong with that. And that was about the time that we kind of picked it up and started working with the 100 on this event. And we felt like, too, men should have a baseline. They should know. So fast forward 10 years, and the Cancer Coalition sits on the Georgia Cancer Control Consortium. We work on the Georgia State Cancer Plan. And now we have a task force that's dedicated just to prostate screening. Should we be doing it in Georgia? And now it's become a clinical guideline again. So, it's kind of come full. I've been here long enough to see it come full circle. So it's kind of funny. But I'm glad we've always done it.
Well, and that is just one of many different screenings and tests and checks. And so for folks that don't have a regular doctor, don't have a family doctor, or don't go for checkups annually, regularly, this is an ideal option.
It is. And the guidelines change too. So what might have been, get your colonoscopy at 50 if you weren't 50 and you thought you could kind of hold off. Well, now you learn at this health event that, it was 45 now and I'm 47. Guess I need to start thinking about that. So I think there's just a good check-in for people as well to kind of make sure that they're on track with the screenings and get what they need.
Erin Hernandez, thank you.
Thank you.
President, CEO of Northwest Georgia Regional Cancer Coalition. Thank you, and appreciate you being on the show.
Of course.
We're going to talk more about the health initiative after this break, so don't go away. We'll be right back.
most affordable bachelor's degree in Northwest Georgia is right here at Georgia Highlands College. High quality and career focused. That's what you can expect at GHC. Apply today at highlands.edu.
Welcome back to Community Watch. Our conversation today is about the Health Initiative for Men and Women, which is coming up on August 17th. And I'm happy, very happy, in fact, to be joined by Bonnie Askew. Welcome.
Thank you. It's good to be back.
You are, of course, a past Rome City Commissioner, but present and longtime member of the 100 Black Men of Rome, Northwest Georgia.
Yes.
And this is one of your organization's premier big annual events. You know, one of the things you focus on annually. Yes. And boy, is it turned into something really important.
This is I guess we would call it our signature event. It showcases our interest in the community and our interest in helping the community to making sure that people understand that their health is important. So we take great pride in that.
Well, I know years ago there was a concern, and talked about it with Aaron Hernandez a little bit in the first segment, about how men were so less likely to go to a doctor to have any problem checked out until it became a huge problem, right? So I'm terribly guilty of that too. But I think that was one of the issues that y'all had in mind when you started this.
Yeah, it's kind of one of those things where men tend to think that unless it's really, really, really hurting, really, really, really bad, I don't have to worry about it. But I'm a witness that it's far better to get these screenings done and to make sure that that you know how healthy you really are, rather than waiting until something's so far wrong that you can't do anything about it.
Yeah. The shift to including women officially, I'm not sure what year exactly that happened, but women were always there.
Yes, women came. They brought their sons, they brought their husbands, they brought their significant others, and even while they were not, it was still the men's health initiative. Women were getting the screenings, and they were more likely to come and get a screening, or to say, okay, I can get a glucose screening, or I can get a skin cancer screening, or I can get this or that. And so it got to the point where they were using it as much as men were. So it was, a natural expansion to go to men and women.
Yeah. And I know you can talk about some of the impact that this event has had.
Yeah. One of the funny stories I remember is Dwayne Reed, who was here who was a former city commissioner and dealer at the Ford Company. He and I sat in the back, and we were joking with some of the guys about getting the PSA screening. But Dwayne and I were telling the guys how important it was. Little did I know that years later I would be diagnosed with prostate cancer. So knowing that I had been getting those screenings and my doctor getting the results, he would look at those results, and he would look at the results from when I went to his office, and he would say, okay, your numbers are in line, so no problem. But one day he said, oh, your numbers went up. We need to check you. So sure enough, I had prostate cancer, but we caught it early enough that it was treatable, and so you know, and even now my wife goes and says, okay, and you need to make sure you get your glucose screening, and you need to get this screening. I'm going, wait a minute, this is for me. I'm supposed to be, but she makes sure that I get screened for those things.
Yeah. Well, the impact on people's lives has been pretty significant. I don't know if y'all have kept track of it over the years, but I remember hearing every year about 2 or 3 people who found out something that in time, fortunately, that they wouldn't have otherwise.
Right, and you know, we get those testimonials all the time. If I had not come to get the screening, I would not have known this, or I would not have known that I was pre-diabetic or diabetic or whatever. So we take, you know, we love to hear the stories. We love to hear the fact that somebody's life was changed because of the fact that they did get the screening and they got it in time. So it's the, you know, and part of our thing is that we don't want the guys to wait until they're 50 years old to start getting a PSA screening, because one of the things that I found, I was sitting in the doctor's office and the doctor came in and said he had a 35-year-old who was whose numbers were far worse than mine, and he was saying that the only reason he came was because of a problem that he had, and come to find out it had been in existence for a while. So the sooner they get screened, the better they are. That gives us a baseline, or gives their doctor a baseline, or them a baseline to work from. So that helps a lot.
So to say that the health initiative for men and women saves lives, I mean, that's not an exaggeration at all.
No, not at all. Not at all. We do know that there are people whose lives have been saved because of the fact that they got the screening, the AIDS screening, the glucose screening, the blood pressure checks, and some of the other things that we do have been very instrumental in helping people get safe, keep themselves alive.
Yeah, you know what I like too is that at this event there are now so many screenings.
Yes.
You can't even name them all. I mean, there's so many. So that's great. It just shows how much it has grown.
You know, it's one of those things. This is a community event. We have so many partners: the Cancer Coalition, a couple of sororities, Atrium, Advent. So it's a community event, and it's the number of screenings have continued to increase, which means that we're helping people be healthier. What we really would like to see is a lot more young men come in and get screened, so that they can establish that baseline. We like to see the older men come in, so that they can say, okay, I've been here, I've done that, and we just want to make sure that everybody understands that this is not something that we do alone, but it's our event. But we do it with the community. It's a community event, and
pretty well attended.
We would love to see the number double.
Yeah.
But the number of people that we serve every year, anywhere from, and because of COVID, the numbers have been down a little bit, but they're on the rebound, and we'd love to see 500-600 people. Usually there's somewhere between 200-300 people that come in.
Well, I mean, since you have talked about it on Community Watch, I'm sure the numbers will double now. So.
Let's make that a challenge. Let's double the number.
So, tell me a little bit about the experience of that day. Now, Aaron Hernandez in the first segment talked about how early the line can start, but once folks get in the room, how does it go from there?
Well, you know, we get there, we set up the tables. We have to be there before they are there. And so if they're there at 6:30, we're there at 6.
Yeah.
We're trying to make sure that they that everybody's set up to where they need to be. You walk in the door, there are screenings to the left of you and screenings to the right of you. You choose which way you want to go. You choose which screenings you want to get, and you walk down and you listen to the vendors, and you get in line for a screening, and you pretty much just choose what you want to do. We'd love for you to do all of them, but we also realize that some people are not going to do certain ones. Some of the men are not going to go out into the mammogram van, and that's understandable, but not that it's not sometimes needed, because men get breast cancer as well.
Yeah.
So we would love to have them do all the screenings, but you walk into the front door and there are vendors who are going to talk to you about your health, about what they can do to help you get healthy and stay healthy. There are screenings in the back, screenings up the hall. You just, and usually there's some fruit, some biscuits or something that you can take. Sometimes some of the screenings, they don't want you to have food before you take them, so we try to make sure that we cover all the bases.
I know there may be a perception among some men in particular that going to a doctor to get a check is a sign of weakness, but really it's quite the opposite. I mean, for men and women, not only for yourselves, but think about all of the people who depend on you to be there and healthy.
Yeah, it's, you know, we as men are supposed to be strong, and we're not supposed to show pain, and we're not supposed. I'm here to tell you that's a false narrative.
Yeah.
We hurt like everybody else hurt, and we have to take care of ourselves. If you don't take care of yourselves now, then down the road, your kids will miss you, your wife will miss you, you'll miss a lot of life because you're too proud to go and say, look, I have this problem, or too laid back to say, you know, I'm going to be a man and I'm not going to tell people that this hurts or that hurts. Mm-hmm. It's best to go ahead and take that step and get it done. Nobody knows what you're going through with you, mm-hmm. and nobody knows better than you. So the best way to take care of yourself is to know your body and know what you need to do to keep yourself healthy.
And this event, you can do that at no cost.
Every screening is free. We thank the doctors, the nurses, the CNAs, all of the people who help us out with this. They volunteer their time. It's a completely voluntary thing. So we just love the people who come out and help us do this to achieve these goals, because we can't do it by ourselves. If you depended on me to do all the screenings, they wouldn't get done. But this is it's all free, and we're glad that people will take advantage of it.
Well, we're totally out of time, so remember that date, August 17th, Saturday. 100 Black Men of Rome, Northwest Georgia's Health Initiative for Men and Women. You need to be there. Thank you, Bonnie Askew.
Thank you for having me.
Thank you for being with us. We'll see you next time on Community Watch.